Hello, my name is Janet Winfrey and I'm the lead for anesthesiology, also known as the numbing tent. The MOM goal is to relieve pain and address the most urgent needs. Anesthesiology is the patient's first encounter with a treatment provider at the MOM, so we want to make it a positive experience. They may be anxious, tired, and unsure of what will be done. When you're ready for your first patient, just use this green station card. Take time to listen to the patient. On the patient encounter sheet, review the health history and triage that will be written here, including pre-meds and priority treatment plan. Verify that the triage lines have the doctor's name and that it's been signed. Tell the patient what area you're going to numb and why. Generally, this is limited to one quadrant. The types of anesthetics that are available may vary, and we may be pushing one type or another depending on our supply. Mirrors and tongue blades will also be available. Protector sheaths, like this, will be on all the syringes for your safety. After giving the injections, on the encounter sheet, you record the number of carpules, the type of anesthetic you use, and do all this in blue ink right here. You'll keep the patient long enough in the chair to assess their numbness, and when you're ready to dismiss your patient, use the red station card. The patient encounter sheet is going to travel with the patient from place to place. When your patients leave, disinfect your chair. Patients are not allowed to walk unattended on the clinic floor, so use your station cards all the time. Runners are present to come get them and they will respond to the cards. As a review, green means bring me a patient. Red means take my patient, I'm finished. Yellow means I need a translator. The white card with the red cross means EMT. And I want to tell you, working in anesthesia, we do have some very anxious patients. If you've got a patient that's just having a little anxiety attack or hyperventilating, these EMT people are trained to talk your patient down. They will come take their blood pressure and make them feel better. And so I want you to use this card if you have a patient in any type of distress. The orange card is for any kind of mechanical problem. You will be standing most of the time in anesthesiology, so take breaks as needed. There is no suction. Patients spit into cups. We are mostly anesthetizing for restorative procedures. Needle stick protocol will be posted, and you report any incident to the lead. Hepatitis B vaccines are recommended for all volunteers. In the anesthesia tent, we also have table volunteers. These individuals sterilize syringes, clearly define areas for clean and dirty instruments, stock supplies, all the anesthetic supplies, the gloves, hand sanitizer. They check the sharps containers and take in the trash. They prepare trays for clinicians. They keep track of the general flow of the event. And some final thoughts. There are busy times and down times. We can't get too many patients numb because the wait to see the restorative dentist may be so long that the anesthesia will begin to wear off. So when there are down times, please be willing to work in restorative, in the family clinic or hygiene area or wherever you're needed. Every volunteer wants to provide meaningful work. I want to say a word about health literacy. A lot of the patients and many volunteers do not know these words, such as restorative, hygiene, prophy, scaling and planing, oral surgery, endo. So just remember to use words that they can understand. And most of all, remember that this is a mission of mercy. Be flexible, be helpful, and be kind to those patients who have come today because they have no other place to receive dental care.